what she said. She's magical, mystical, or a powerful wonder girl.
Exercise has been called a miracle drug that can benefit every part of the body, extend our lifespan, and halt the global pandemic of inactivity that some are calling the greatest public health problem of the 21st century. Joining us now is Sarah Hudson, the founder of Canada's Live Well Exercise Clinic, to talk about how we can use exercise to fight chronic disease. Welcome to What She Said.
Thank you so much. Thank you for having me.
This is so topical.
Absolutely.
In Canada, 3 out of 5 people live with at least one chronic disease.
Yes.
And 4 of 5 are at risk. But only 20% of Canadians get the recommended 150 minutes of exercise per week. What are the main challenges people face when trying to adopt a healthier lifestyle?
You know, I think this is just such a great topic because the reality is it's hard to live a healthy lifestyle in today's society. I think there's really kind of 4 main reasons as to why people struggle to live a healthier lifestyle. The number one thing is time. We're all very busy. And so fitting in exercise and preparing our nutrition and not eating out and not always grabbing takeout, which seems quicker and faster.
I think you're absolutely right, because time is the commodity that is priceless.
Absolutely.
So you're choosing between getting enough sleep and exercising sometimes.
Yeah, absolutely. And I think the second thing is just the conveniences of society today. We don't have to walk many places. Mm-hmm. We're able to be transported. The elevators and the escalators are always very shiny, attractive ways for us to move our bodies up and down floors. And usually the stairs are quite hidden and sometimes behind a closed door. So society has actually made it quite difficult for us to move our bodies on a regular basis.
Now, you said the recommended 150 minutes of exercise per week.
Yeah.
What kind of exercise? Is doing 150 minutes of walking the dog at a good rate, is that considered exercise, or are we talking about, full-on cardio, weights, that kind of thing?
Yeah, I think that's a great question. So we talk about 150 minutes of moderate to vigorous exercise. Mm-hmm. And so what exactly does that mean? It does mean that we are getting our heart rate up and maintaining an elevated heart rate. And so again, the way that we can know that is that we do become a little bit breathless with exercise. And on a scale out of 10, we should really be feeling like this exercise is 3, 4, maybe 5 out of 10 in terms of the intensity of the exercise. And then that we actually know that we're right in that sweet spot of getting the health benefits that exercise has to offer us.
Because that doesn't sound like a lot.
Exactly.
What's like just over 2 hours.
Yeah. And the really beautiful thing about it is it can be broken up any way we want. 5 minutes of moderate to vigorous exercise, it can all add up and be meaningful. We don't have to do an hour at a time for it to be meaningful exercise.
I've been known to do squats while waiting for the coffee to brew.
Perfect. And working it into our daily lives is the best way to get at it.
So how does Live Well use exercise as medicine to prevent or in fact treat chronic disease, promote mental health, and help Canadians live healthier for longer?
Well, we know that exercise is medicine. And in fact, the American College of Sports Medicine says that our dose of physical activity is the number one predictor of our overall health. And I think that that's really important for us to remember. And that's really what we are doing in our clinics is we have created an environment that allows people to start where they are, to start low and to move slow, and to start to build exercise and healthy habits into their daily life. But not all exercise is equal exercise. Mm-hmm. And so when we really look at, somebody who has diabetes versus somebody who maybe is struggling with their weight, we have to approach both of those exercise prescriptions differently, just as we would approach all different ailments with a different medication from our doctor. Exercise is medicine, but there's a specific prescription for a specific individual based on where their health profile is.
So what makes you different from any other trainer or someone out there?
Yeah. So Live Well Exercise Clinic is very unique in that we are actually everything that a gym is not. We've often been called the anti-gym in that we only have about 300 members in our clinic, offering a very personalized and customized experience. But the number one thing is that we have a very non-judgmental, non-intimidating environment that allows people to come to us and to really have us meet them where they are and to feel accepted and part of something, and to also have a fun, social, and inspiring time when they're with us.
Well, you just opened your first clinic in Toronto. You've got 2 more coming this spring if spring ever gets here, in Oakville and Burlington. Describe your typical member. Who is Live Well Exercise for?
You know, our typical member typically ranges in age between about 50 and 70 years old. And, you know, as an individual who comes to us and says, it's time for me to focus on my health. It's time for me to take that time for myself and to be more active and to start to make better eating choices, to sleep better, to reduce my stress. Now is the time for me. And our members come to us sometimes for prevention, so to prevent chronic disease. But oftentimes it's that, you know, my doctor's told me that my blood pressure is getting a little bit higher. You know, I'm carrying some extra weight. I'm not sleeping as well at night. You know, there's a variety of reasons why somebody would come to us, but the focus is always a health focus. The focus is not, I'm looking to get a bikini body or to build big muscles. That's what a gym is for. We have a very serious health focus at Live Well.
So what training would your staff have that most personal trainers or gyms wouldn't be able to provide?
So our exercise sessions are led by clinical exercise physiologists, a big long word that most people have never heard of. But they are a group of clinical healthcare professionals who are specialized in exercise, nutrition, and lifestyle change for people with chronic disease and for those looking to prevent chronic disease. So these are individuals who have a university degree in exercise science or kinesiology, and then a postgraduate certification through the American College of Sports Medicine in clinical exercise physiology. So it's a very specialized field that supports people to make lifestyle changes.
So how does the health coaching work?
You know, health coaching is something that is becoming more and more popular today, and that we recognize that we need coaching in order for us to achieve our goals. And the 2 things that our coaching program provides to our members is focus and accountability. We often approach lifestyle with an all or nothing mentality. We want to try a diet, and so we kind of go at it all or nothing, and we try it, and then we end up ultimately giving up on it. And what our health coaching program does is it allows people to break up their plan into small strategic steps and to focus on specific things and to be highly accountable to those, to their coach in the clinic for achieving those. And we know that that process and that program is what works to make changes.
Have you got a story about one of your members? Something you can tell us?
Yeah, you know, one of my favorite stories is our member Bev. And Bev is a 55-year-old female who came to our clinic because her doctor had said to her, you know, you're about 25 pounds overweight. Your blood pressure is up. Your blood sugars are up. You're borderline diabetic now, and you need to be more active. And Bev didn't really know where to start, and a gym did not feel like a comfortable place for her. So Bev came to Live Well Exercise Clinic, and over time, as Bev started to exercise, Bev reduced her blood pressure, not needing medication anymore for her blood pressure. Bev was able to reduce her blood sugars because exercise is medicine for managing our blood sugars. And ultimately, Bev was able to get off of her medications under the direction of her physician and was able to use exercise and healthy eating in order to manage her health and ultimately to feel better. And in fact, Bev's goal in coming to Live Well was to be a better grandma. And that really is what she was able to achieve.
Well, your new Yorkdale Clinic is located right near Yorkdale Mall on Bridgeland Avenue. Where can people go to learn more?
Our website has a lot of great information on it. It is livewellclinic.ca, and it lists all of our locations. As we continue to expand across Canada, you will see more locations popping up. We've been franchising since 2016, and so we expect to have more locations in the Ontario area this year.
Well, that's fascinating. Sarah Hudson, thank you very much for joining us today.
Thank you so much, ladies.
Well, she said